Today, we're talking about something that's sudden, it's frightening, and it can happen when our loved ones are at their most vulnerable. We're going to navigate the sudden fog of delirium. So, I want you to imagine something for a second. What actually happens when the mind of someone you know, someone you love, someone who's always been clear and sharp, just suddenly seems to go offline? It is a truly terrifying experience. You know, one minute you're having a completely normal conversation with your parent or your partner, and then the next, they're just lost. They might be agitated, restless, and in some of the hardest moments, they might not even know who you are. And it isn't a slow fade. It's like a switch has been flipped. Well, this experience, it has a name. And just knowing that name is the first real step toward helping. It's not just being confused. It's a very specific medical event. And this is absolutely crucial to understand. This sudden, dramatic shift is not dementia. It's not Alzheimer's. Those conditions are typically chronic. They develop over a long time. Delirium is acute. It happens suddenly, and it's a sign that something is wrong right now. It is a medical emergency. So, what is delirium really? Let's unpack it and get a much clearer picture of what's actually going on inside the brain. Okay, so clinically it's defined as an acute fluctuating syndrome. Now that sounds a bit dense, so let's break it down. Acute means it hits fast. Fluctuating means the confusion can actually come and go in waves. It's basically a temporary storm in the brain where thoughts get jumbled, it's hard to pay attention, and this is key, it's almost always caused by some other medical issue. You know, maybe the best way to think about it is like a temporary short circuit in the brain's wiring. The whole system gets scrambled because the body is under some kind of major physical stress. The important thing to hold on to here is that this isn't permanent damage. It's just the brain struggling to function while it's under attack. So what does this short circuit actually look like? Well, first, the onset is sudden. We're talking hours or days, not months. A person's state can swing wildly. One moment, they might be really agitated and restless, and the next, they're incredibly drowsy and hard to wake up. They'll have a terrible time trying to focus on anything, and very often, you'll see their sleep schedule get completely flipped, awake all night and sleeping all day. It's a deep, deep disorientation. This brings us to the most important question, right? For any family member, for any caregiver, if this is a temporary short circuit, what's flipping the switch? What's actually causing it? You can really think of delirium as the brain's alarm bell. It's screaming that there's a problem somewhere else in the body. And you might be surprised by the most common culprits. Often, it's an acute infection, something like a urinary tract infection or pneumonia. But really, a lot of things can set it off. A new medication, the incredible stress of a major surgery, or even something that sounds simple, like being severely dehydrated. The body is under siege, and the brain is often the first to show the signs. Knowing what causes it is so critical because it points us directly to the solution. This is not a hopeless situation at all. There is a clear road back to recovery, and that path forward is really twofold. First, the doctors have to play detective. They've got to find and treat that underlying trigger, get rid of the infection, fix the dehydration, sort out the medication. But just as important is the second part, creating a calm, supportive, and healing environment so the brain has a chance to reboot. And the power of the environment here, wow, it cannot be overstated. Think about a chaotic hospital setting. You've got beeping machines, harsh fluorescent lights, strangers coming in and out. That is pure fuel for delirium. But the antidote can be surprisingly simple. A quiet room, maybe some familiar pictures from home, consistent lighting, and just the calm, reassuring presence of someone they love. These small changes give a struggling brain the calm space it desperately needs to heal. So, if you're ever supporting someone through this, it all boils down to 4 pillars. 1, safety first. A confused person is a huge fall risk, so you have to create a safe space. 2, reorient them, but gently. Don't quiz them, just state calmly, hey, it's Tuesday afternoon, you're in the hospital, and you're safe. 3, communicate clearly. Simple words, short sentences. And 4, support their basic physical needs. Gently encourage them to eat and drink and help them move around a bit if it's safe. So we've covered what delirium is, what triggers it, and how we can help. But let's land on the single most important message you should take away from all of this. And here it is. Delirium is often reversible. It is not a one-way street. With quick recognition and treatment of whatever's causing it, that mental fog can lift. The person you know, the person you love, they can come back to you. Spotting it early is everything. So, you see, this isn't just some abstract medical knowledge. It's a practical tool. Now that you can recognize the signs, that sudden onset, the way it fluctuates, the deep confusion, and you know it's an emergency, the final question is really for you. Could you be the one to sound the alarm? Could you be the one to help guide someone back to clarity?